She was just a rookie nurse, the one nobody noticed. A hospital in chaos, a dozen lives on the line. Her boss tried to destroy her career, calling her a fraud. Then 2 black helicopters landed on the roof, and the man who stepped out wasn't a doctor. He was a general, and he was looking for her. Now, let me take you inside St. Jude's Metropolitan Hospital on the worst night of its history. The air in the emergency department was a tired soup of smells. Bleach, sharp and sterile, fought a losing battle against the metallic tang of blood and the sour note of human fear. Underneath it all was the hum, a constant, low-frequency thrum from the fluorescent lights, the chorus of a dozen different machines beeping and whirring, each one a tiny prayer for a life hanging in the balance. To Nurse Alara Vance, it was just noise, background radiation. She moved through the controlled chaos of a Tuesday night shift with an economy of motion that bordered on invisible. Her worn sneakers made no sound on the polished linoleum. Her hands, when they checked a patient's pulse or adjusted an IV drip, were swift and sure. Her touch a fleeting moment of professional calm. She was new, 6 weeks out of orientation, a ghost in blue scrubs, and that was exactly how she wanted it. She refilled a tray with sterile gauze, her movements precise, automatic. Each square was perfectly aligned, each roll of tape placed just so. It was a small, meaningless ritual, but the order it created was a dam against a reservoir of memories she worked tirelessly to keep sealed. Memories of dust and screams, of a sun that baked the world into a brittle tan wasteland, of a different kind of humming, the sound of rotors beating the air into submission. "Vance!" The voice cut through her concentration like a shard of glass. It was smooth as expensive whiskey, but with an edge of pure condescension. Dr. Alistair Finch, head of emergency medicine. He stood by the nurse's station, not looking at her, but at a chart in his hand. His suit was immaculate, a dark gray masterpiece that probably cost more than her car. It looked out of place, an artifact from a cleaner, more important world. "Yes, doctor?" Alara kept her voice neutral, her eyes on her task. "Bed 4's pressure is dropping. I ordered a bolus 20 minutes ago. Did you administer it, or are you too busy with arts and crafts?" He gestured vaguely with a manicured hand toward her neatly organized tray. She didn't look up. "I administered it 19 minutes ago, doctor. 500 cubic centimeters lactated ringers. I also drew labs and sent them to Stat. His potassium was elevated on the last panel. I suspect it might be a factor." There was a beat of silence. The soft clicking of his pen against the chart was the only sound. "You suspect," he repeated, the words dripping with disdain. "You are a nurse, Vance, a new one. Your job is to follow orders, not to play diagnostician. Do you understand me?" "Yes, doctor." The words were ash in her mouth. "Good." He snapped the chart closed and moved on, his expensive leather shoes squeaking with authority. He was a man who commanded space, who sucked the air out of a room and left others to gasp in the vacuum. He smiled like a man of God, but ruled his department like a petty tyrant. Everyone knew it. No one said it. His reputation, his connections to the hospital board, they were a human shield made of silence and authority. Alara finished her tray. She didn't let her shoulders tense. She didn't let her jaw clench. She had learned long ago how to make her body a fortress. Outwardly, she was placid water. Inwardly, a switch had been flipped. The quiet life she was trying to build, brick by painful brick, felt fragile. Men like Finch always had a way of finding the cracks. She moved to bed 4. An elderly man, pale and breathing shallowly. His skin felt like cool parchment. She checked his vitals. The pressure was still soft. Finch's bolus hadn't touched it. Her suspicion about the potassium gnawed at her. A simple dose of insulin and D50 could correct it, could pull him back from the edge, but it required a doctor's order, an order Finch would never give because the idea had come from her. She documented everything meticulously, the time, the vital signs, her observation. Her notes were her only weapon, clean, factual, undeniable. She had learned that in another life, too. Paperwork was a shield. It could stop a bullet, or it could stop a career-ending accusation. It all depended on how well you built it. The rest of the shift crawled by. A drunk with a split lip, a child with a fever, the usual Tuesday night parade of minor miseries. Alara worked, kept her head down, and felt Finch's eyes on her from a distance. He was watching her now. She had challenged him, however quietly, and he would not forget it. She was a loose thread on the perfect tapestry of his authority, and he would eventually pull it until she unraveled. She took her break in the small, windowless staff room. The air was thick with the smell of stale coffee and microwave popcorn. Two other nurses were huddled at a table, their voices low. "He did it again," one of them, a veteran named Maria, whispered. "Old man Hemlock in bed 4. Finch completely missed the hyperkalemia. Vance caught it, put it in the chart. Finch just wrote an order for Kayexalate and acted like it was his idea all along." "She's good," the other nurse, a young man named Ben, said. "Too good. He hates that." "He'll get rid of her," Maria said, her voice flat with resignation. "He always does. Anyone who makes him look less than perfect, they're gone within a month. Transferred, written up for some nonsense, or they just quit. He breaks them." Alara sat in the corner pretending to read a medical journal. Their words were stones dropping into the deep well of her anxiety. She had come here for peace, for anonymity. She had left the desert, the dust, the constant grinding pressure of life or death decisions, to be here, to be a normal nurse in a normal hospital. But the politics, the egos, they were just a different kind of war zone. A cage of her own paranoia was beginning to form around her. When she returned to the floor, Finch was waiting for her. He held a tablet, his finger jabbing at the screen. "Vance, a word. In my office." His office was an extension of himself, cold, minimalist, and expensive. A large mahogany desk separated them. He sat. She stood, a classic power play. "I've been reviewing your file," he began, his voice dangerously soft. "Community college nursing degree. No prior experience listed before this hospital. A little thin, don't you think? For someone who seems to have such a wealth of diagnostic opinions." "I completed my training and was hired, sir," she said, her hands clasped behind her back, her posture rigid. The position was called parade rest. She forced herself to relax, to slump just enough to look like a civilian. "You did," he agreed, a predatory smile touching his lips. "And I'm beginning to wonder if human resources made a mistake. You're overstepping, Nurse Vance. Your actions tonight with the patient in bed 4 were insubordinate. You are not a doctor. You will remember that. Or I will make sure your career in medicine is so short it will be nothing more than a clerical error." The threat was naked, undisguised. Humiliation washed over her, hot and sharp. She had saved that man's life. Her quiet observation, the one Finch had stolen and taken credit for, had prevented a fatal arrhythmia. And this was her reward. A threat. A dismissal. "I understand, doctor." "See that you do." He waved a hand, dismissing her. "Now get out and try to do the job you were actually hired for." She walked out of his office, her face a mask of calm. But inside, the dam was cracking. A tremor of cold, professional fury, an emotion she hadn't allowed herself to feel in years, shook its foundations. She had faced men with guns, men with bombs, men who wanted to kill her and her entire team. And she had never felt as powerless as she did standing in that sterile, quiet office. The first sign that the night was about to shatter came not as a sound, but as a vibration. A low, deep shudder that traveled up from the concrete floor, through the soles of her shoes, and into her bones. It was the distant, concussive boom of an explosion. Seconds later, the pagers and phones erupted in a cacophony of alerts. A multi-vehicle pileup on the I-17 overpass, a tanker truck involved, multiple casualties, en route. The ER exploded into motion. It was no longer controlled chaos. It was just chaos. Nurses shouted for supplies. Orderlies ran with gurneys. The charge nurse's voice was high and strained over the intercom, calling for all available staff. Finch emerged from his office, looking flustered. He barked orders, but they were disjointed, contradictory. "Get me trauma gowns. Someone call the blood bank. Where are the surgical residents?" He was a man drowning in a situation far beyond his administrative capabilities. Then they began to arrive. It was a flood of broken bodies and terrified screams. The paramedics' reports were a frantic litany of injuries: crushed chests, compound fractures, severe burns, head trauma. The air thickened with the smell of burnt plastic and gasoline that clung to the victim's clothing. Alara felt a strange sense of calm descend upon her. The noise, the fear, the blood. It all faded into a clear, sharp focus. The world slowed down. This, she knew. This was familiar territory. The years of training she had tried to bury surged to the surface, not as memory but as pure, undeniable instinct. She saw a young man on a gurney, his breathing ragged and shallow. One side of his chest wasn't rising, his face was turning a dusky blue. A paramedic was trying to bag him, but it wasn't working. "He's got a tension pneumothorax," the paramedic yelled. "We need a chest tube now." Finch was across the room, arguing with a surgeon about operating room availability. He didn't even hear. The resident who should have been there was frozen, his eyes wide with panic. The man on the gurney gasped, a wet rattling sound. He had seconds. Alara moved. She didn't think. She grabbed a 14-gauge IV catheter from a nearby cart, the largest bore they had. She snatched an alcohol wipe. There was no time for proper sterile procedure, no time for anesthetic. There was only time for a life. "What are you doing?" the resident stammered. "You can't do that." She ignored him. She located the second intercostal space, mid-clavicular line, a place she could find in her sleep. She wiped the skin once. "Hold him," she commanded the paramedic. With a firm, practiced motion, she plunged the needle into the man's chest. There was a sickening pop as it punctured the pleura, followed by a hiss of escaping air. The man's body shuddered. The side of his chest that had been still began to rise and fall. The blue tint on his lips began to recede. "One. Vance!" Finch's voice was a roar. He had seen her. "What in God's name do you think you're doing? That is assault. You're finished." She didn't look at him. She secured the catheter with a piece of tape she had ready in her pocket and moved on. Her mind was already cataloging the room, a rapid-fire assessment of injuries, a mental triage. Not him. His leg was mangled, but he was screaming. Screaming was good. It meant he was breathing. Not her either. Burns, but she was conscious and alert. Then she saw the little girl. No more than 6 years old. She was lying on a gurney tucked against a wall, forgotten in the chaos. She was pale, her skin clammy. Her eyes were unfocused. Her pulse, when Alara's fingers found the carotid artery, was thready and fast. Shock. She was bleeding internally, dying quietly while the louder patients got the attention. "I need a pressure bag and 2 units of O-neg, now," Alara shouted to Ben, the young nurse from the break room. He stared at her, then at Finch, who was still fuming. "Now," she repeated, her voice cracking like a whip. Ben scrambled to obey. Alara elevated the girl's legs. She needed to get her blood pressure up, to perfuse her vital organs. Standard procedure was to pump her full of fluids, but it would take too long. She needed to buy time. She placed her thumbs on 2 specific points on the girl's abdomen, just below the rib cage, pressing down with firm, steady pressure on the descending aorta. It was a technique not found in any standard nursing textbook, a field maneuver designed to slow catastrophic internal bleeding. A desperate, last-ditch effort. The girl's eyelids fluttered. A flicker of consciousness. The monitor, when Ben finally wheeled it over, showed a blood pressure that had risen from 60 systolic to 80. It wasn't much, but it was the difference between life and death. 2. The room was a sea of bodies. There was no system, no organization. Patients with minor injuries were taking up beds and staff attention, while critical cases were being overlooked. Alara saw the colored tape on a supply cart. Green, yellow, red, black, the colors of triage. She ripped off 4 long strips and slapped them onto the wall near the entrance. "Listen to me!" she yelled, her voice cutting through the din. Everyone stopped for a fraction of a second, stunned by her sudden authority. "Green is walking wounded. Get them to the waiting room. Yellow is delayed. They're stable but need care. Put them in the side bays. Red is immediate. They need a trauma bay right now. Black is expectant. Get them to the chapel hallway and make them comfortable." It was brutal. It was ruthless. It was the only way. A few of the older, more experienced nurses recognized the system instantly. They nodded and got to work, directing the panicked junior staff. Finch just stared at her, his face a mask of apoplectic rage. She had seized control of his department from under him. She moved from patient to patient, a whirlwind of competence, tying a tourniquet on a severed limb, her knot precise and non-slip, diagnosing a cardiac tamponade by the muffled heart sounds and distended neck veins, screaming for a pericardiocentesis tray, clearing an airway with 2 fingers and a swift practice scoop. 3, 4, 5, 6. She found a firefighter slumped against a wall, complaining of a headache. He had been cleared by a cursory exam. But Alara saw the subtle signs. One pupil was slightly more dilated than the other. His speech was just a little slurred. She grabbed a penlight. When she shone it in his eyes, the blown pupil barely reacted. "He has a head bleed," she said to the nearest doctor, a surgical resident. "He needs a CT and a neuroconsult immediately." "He looks fine," the resident protested, overwhelmed. "He's not fine," Alara said, her voice dropping to a low, intense frequency that allowed no argument. "He's got an epidural hematoma. In 20 minutes he'll be unconscious. In an hour he'll be dead. Get him to the scanner." The resident, shaken by her certainty, obeyed. 7. The hour was a blur of motion and instinct. She was everywhere at once. She directed the flow of patients. She started lines, administered drugs, and bagged the breathless. She was not Nurse Vance. She was a different person, a woman forged in the crucible of combat, her skills honed to a razor's edge. She was a force of nature in a world that had suddenly turned to chaos, and in that chaos she found a terrible, familiar clarity. 8, 9, 10, 11. The final one was a direct confrontation with Finch. A woman had been brought in, pregnant, with severe abdominal pain. Finch had taken one look at the chaos and the lack of an available ultrasound machine and diagnosed her with Braxton Hicks contractions, a common and harmless condition. He ordered her to be given a mild sedative and moved to the hallway. "She has a placental abruption," Alara said, standing directly in his path. She had felt the woman's abdomen. It was rigid as a board, a classic sign. "She's bleeding out, and the baby is in distress. She needs an emergency C-section right now." "Get out of my way, Vance," Finch snarled, his face mottled with fury. "I am the doctor here. I make the diagnoses. You are a nurse who is about to be fired and charged with criminal negligence. Her pressure is 80/40 and dropping. Her heart rate is 140, and I can't find the baby's heartbeat with the Doppler," Alara said, her voice cold and steady. She held up the Doppler for him to hear the static. "You can have my badge. You can have my license. But you will not let this woman and her child die because of your ego. You will call the OB team, or I will." For a moment, they were locked in a standoff in the middle of the ER. The staff around them fell silent, watching. Finch's authority, already eroded, was being openly challenged. He looked from Alara's unwavering eyes to the pale, sweating face of the pregnant woman on the gurney. He saw the lawsuit in her eyes, the scandal. He broke. "Fine," he spat. He whirled around and bellowed for the OB team. The woman was rushed to the operating room. 12, and a 13th unborn. As the last of the critical patients were moved to the OR or the ICU, a semblance of order began to return. The noise level dropped from a roar to a steady hum. The floors were slick with things Alara didn't want to identify. The staff moved with the slow, heavy steps of exhaustion. The adrenaline was wearing off, leaving behind the bone-deep ache of what they had just endured. The crisis was over, and Alara knew with absolute certainty that her own personal crisis was just beginning. Finch cornered her by the biohazard bins. He wasn't alone. He had flanked himself with the hospital administrator, a perpetually nervous man named Mr. Davies, and 2 hulking security guards. It was an ambush. "That's her," Finch said, pointing a trembling finger at Alara. "That's the nurse who has been practicing medicine without a license all night. She has endangered patients, ignored direct orders, and violated every protocol this hospital has." "Mr." Davies wrung his hands, his eyes darting around nervously. "Dr. Finch, the preliminary reports suggest that mortality rates for this incident are surprisingly low." "That's luck, not skill," Finch blustered, his voice rising. "She performed an invasive thoracic procedure without a doctor's order. She administered medications I didn't approve. She created a triage system that is not hospital-sanctioned. She is a menace, a fraud." Alara stood perfectly still. She was too tired to fight. The mask of the calm, efficient combat medic was slipping, revealing the exhausted woman who just wanted to be left alone. She had saved 12 people. And this was the consequence. The humiliation was a physical weight, pressing down on her chest. "Nurse Vance," Davies said, his voice weak. We have to take Dr. Finch's accusations seriously. You're being placed on administrative leave, effective immediately. Security will escort you from the premises. We'll need your badge and ID. This was it. The end of her quiet life. The end of the career she had tried so hard to build from the ashes of her past. She looked around the room. Maria and Ben were watching, their faces etched with sympathy and fear. The other staff averted their eyes. No one would speak up. Finch's power was too absolute. The two security guards stepped forward. One of them, a large man with a kind face, looked genuinely sorry. "Ma'am, I need you to come with us." She nodded, a small, defeated gesture. But as she reached for her badge, a spark of the old defiance, the cold fury from before, ignited within her. She would not go quietly. She would not let him win completely. She turned to the nurse's station computer. "I need to finish my charting," she said, her voice flat. "Everything has to be documented." Finch scoffed. "You're not touching a hospital computer. You're fired." "It's a legal requirement," Alara stated, looking at Davies. "If I don't document the care I gave, the hospital is liable. Every intervention, every medication, everything." Davies paled at the mention of liability. "Let her finish her charts," he said quickly. 5 minutes, then she's out." Alara sat down. Her fingers flew across the keyboard, her entries concise, professional, and damningly accurate. She documented the tension pneumothorax, noting the absence of an available physician. She documented the child in shock, noting the time it took for her orders for blood to be fulfilled. She documented everything, building her paper shield one last time. Then, she opened the hospital's internal messaging client. She composed a new message. The recipient was a dummy address she knew didn't exist. It would bounce, but that didn't matter. It was the subject line that was important. She typed the words carefully, her heart pounding a slow, heavy rhythm against her ribs. Subject: Case File 99B7, Urgent, Nightingale Protocol. It was a signal she had been trained never to use. A last resort distress call, reserved for operatives in deep cover whose lives were in imminent danger. She wasn't in mortal danger, but her life, the one she had chosen, was being executed right in front of her. It was a desperate, hopeless gamble, a shot in the dark. She hit send. The message vanished into the ether. "Time's up, Vance," Finch said, his voice dripping with satisfaction. Alara stood up. She unclipped her badge and handed it to the security guard. The plastic felt heavy, like a medal for a battle she had lost. She was a ghost again, but this time she was being exorcised. "This way, ma'am." As the guards began to lead her toward the exit, a new sound started. It was faint at first, a rhythmic thumping from far away. It grew steadily louder, a deep percussive beat that seemed to vibrate in the very air of the hospital. It wasn't the high-pitched whine of a medevac helicopter. This was a heavier sound, deeper, more powerful. Heads turned. Nurses and doctors walked to the windows that looked out over the city. The sound grew into a deafening roar. It was directly overhead. "What is that?" Davies asked, his voice trembling. "We weren't expecting any more transports." Then they saw them. 2 of them, sleek, black, and utterly unmarked. They were military-grade helicopters hovering over the hospital's rooftop helipad with impossible stability. They looked like predators that had descended from the night sky. The doors to the roof burst open. Not paramedics, not flight nurses. 6 men in black tactical gear, armed and moving with a terrifying fluid precision, swarmed into the hallway. They didn't speak. They fanned out, securing the entrance to the ER with practiced efficiency. The staff flattened themselves against the walls, their faces a mixture of fear and astonishment. Finch stood frozen, his mouth agape. "Who are you people? You can't be in here. This is a sterile environment." The men ignored him as if he were a piece of furniture. They parted, creating a path. A man walked through them. He was tall, in his late 50s, with close-cropped silver hair and a face that looked like it had been carved from granite. He wore an immaculate army dress uniform, the chest laden with ribbons, the shoulders adorned with the stars of a lieutenant general. His presence was an overwhelming wave of pure, undiluted authority that made Finch's petty tyranny seem like a child's tantrum. He was General Marcus Thorne, and his eyes, the color of a winter storm, swept the room once, cataloging everything, missing nothing. They landed on Alara, The security guards who were holding her arms let go as if they had been burned. They took a step back. The general walked a straight line across the ER floor, his polished boots making no sound. He walked past the stunned Mr. Davies. He walked past the sputtering Dr. Finch. He did not slow down. He didn't deviate. He stopped directly in front of Alara. The entire emergency department held its breath. He looked at her, his expression unreadable. For a moment, he simply took in her appearance. The cheap blue scrubs, the splatter of blood on her cheek, the exhaustion in her eyes. Then he spoke, and his voice was not loud, but it commanded the absolute, undivided attention of every person in the room. It was a voice used to giving orders that shaped the fates of nations. "Sergeant Vance," he said. It was not a question. It was a statement of fact. "Report." The name hit the room like a physical blow. Sergeant, not nurse. A wave of confusion and shock rippled through the staff. Finch's face went from red with anger to a pasty, sickly white. Alara's training, the part of her she had tried to kill, took over. Her posture straightened. Her exhaustion fell away like a cloak. She stood at attention, her eyes locked on his. "Sir," she began, her voice clear and steady. "Mass casualty incident. Initiated approximately 2100 hours. Multi-vehicle collision with tanker involvement. Department was overwhelmed. Command and control structure failed. I instituted field triage protocols to manage patient flow and prevent further loss of life." The general nodded slowly, his eyes never leaving hers. "Losses?" 12 critical patients stabilized and transferred to surgical or intensive care units, sir. 2 DOAs arrived on scene. 0 patient losses within this facility post-arrival. "And your status?" he asked, his gaze flicking for a fraction of a second to the security guards and the furious doctor behind her. "My civilian employment has been terminated, sir. I was accused of acting outside my scope of practice." General Thorne's expression didn't change, but the air around him grew 10 degrees colder. He turned his head slowly, deliberately, to face the trembling hospital administrator. "Mr. Davies," the general said, his voice dangerously calm. "I am Lieutenant General Marcus Thorne, United States Army. The woman you know as Alara Vance is Sergeant First Class Alara Vance, an active-duty Special Operations combat medic. Specifically, she is one of the most decorated medics in the entire pararescue community. She has more confirmed field saves under direct enemy fire than any other operator in the last decade. She holds the Distinguished Service Cross, 2 Silver Stars, and a chest full of other commendations I doubt you would even recognize." He took a step closer to Davies, who seemed to shrink under his gaze. "Her scope of practice," the general continued, his voice laced with icy contempt, "includes performing emergency surgical cricothyrotomies with a pocket knife, setting compound fractures with nothing but sticks and duct tape, and keeping a platoon of Rangers alive for 72 hours behind enemy lines with half a medical kit and a bottle of iodine. The needle thoracostomy she performed tonight, she teaches that course at Fort Bragg, to surgeons." A collective gasp went through the room. Maria's hand was over her mouth. Ben looked like he was seeing a ghost. The general turned his attention to Finch, who was now sweating profusely, his expensive suit looking wilted and cheap. "You," Thorne said, the single word carrying more menace than a shouted threat. "You accused one of my people of being a fraud." I didn't know," Finch stammered, holding up his hands. "She's registered as a nurse. Her credentials are part of a federally protected identity program for transitioning special operations personnel," Thorne cut him off. "A program you have just compromised. The Nightingale protocol she activated is a signal that one of our assets is under duress from a direct threat to their life or livelihood. When we get that signal, we don't just send a response. We investigate the threat." As he spoke, 2 of his tactical team members approached, holding a tablet. They had not been idle. While Thorne was speaking, they had been working, quietly, efficiently. "And what we have found, Dr. Finch," Thorne said, as his man turned the tablet screen for Davies to see, "is interesting." On the screen were financial records, shipping manifests, inventory logs for the hospital's pharmacy and supply closets. "It seems this hospital has a remarkable rate of inventory shrinkage," the general said conversationally, "especially in high-end oncology drugs and surgical equipment, things that have a very high resale value on the black market. We also found encrypted communications on your office computer, and several very large, very recent deposits into an offshore account in your name. Finch's face crumpled. The arrogant, blustering mask dissolved, revealing the pathetic, cornered criminal beneath. This is insane. It's a lie. You have no right. We have every right, Thorne said, his voice dropping to a whisper that was somehow more terrifying than a shout. When you threaten one of ours, you make yourself an enemy of the United States Department of Defense. And we are very, very thorough when we investigate our enemies. He turned back to the ashen-faced administrator. Mr. Davies, you have a choice. You can deal with the mountain of lawsuits that will come from your patients when they learn your head of emergency medicine was a criminal who deliberately understocked his own department. You can deal with the federal investigation into your hospital's finances. Or you can take my offer. Davies looked like a man being offered a life raft in the middle of a hurricane. Offer? He squeaked. Dr. Finch's employment here is terminated, effective immediately. He will be leaving with my men, who will escort him to a secure facility to have a very long conversation with some federal investigators. His medical license will be revoked by morning. His assets will be frozen. He will, for all intents and purposes, cease to exist. The general gestured to his men. They moved in on Finch, who didn't even have the energy to protest. They took him by the arms and led him away, his expensive shoes scuffing on the floor he once commanded. His career, his life, had been dismantled and destroyed in less than 5 minutes. Thorne wasn't finished. His eyes settled back on Davies. That is step 1, he said. Step 2 is this. Your emergency department is currently without a leader in the middle of a crisis. That is a liability. Therefore, under the authority granted to me by the National Security Act, I am invoking an emergency public health mandate. As of this moment, Sergeant Vance is the acting head of this department. The shock in the room was palpable. Alara herself felt her knees go weak. Head of the department? Her? She will have complete operational control until such time as a permanent replacement can be found, Thorne continued, his voice leaving no room for negotiation. A replacement who will be vetted and approved by us. Is that clear? Davies could only nod, his head bobbing up and down like a puppet on a string. Yes, Crystal, absolutely. Thorne looked back at Alara. The hard granite expression on his face softened for just a fraction of a second. He gave her a single, almost imperceptible nod. The power in the room had shifted, completely and irrevocably. It now resided with the quiet rookie nurse in the blood-stained scrubs. The tactical team filed out as quickly and silently as they had arrived. The sound of the helicopters receded, leaving behind a stunned, ringing silence. For a long moment, no one moved. Alara stood in the center of the room, the new, unwanted epicenter of authority. Then, Maria, the veteran nurse, walked over and handed Alara a clean trauma gown. "What do you need, boss?" she asked, her voice filled with a newfound, profound respect. The simple question broke the spell. Alara looked around at the exhausted faces, the messy but stable ER, the 12 patients whose lives she had held in her hands. She was no longer a victim. She was no longer a ghost. She took a deep breath, the sterile, bleach-scented air filling her lungs. "All right," she said, her voice quiet but firm, the voice of command returning as if it had never left. "Ben, I want you to coordinate with the ICU. Get a bed count. Maria, let's get this place cleaned up and restocked. We're not done yet." The staff, who had cowered under Finch's loud and useless orders, jumped to obey her quiet, precise ones. An underground railroad of courage seemed to form, as nurses who had been silent for years began to work with a renewed sense of purpose. The ER, which had been a place of fear and chaos, began to transform into a bastion of pure, unadulterated competence under her command. Later, as the sun began to hint at the horizon, painting the city skyline in shades of gray and pink, General Thorne reappeared at her side. The ER was quiet now, humming with the steady, reassuring rhythm of machines monitoring stable patients. "You've got things under control," he observed. It wasn't a question. "It's what I do, sir," she replied, not looking away from a monitor displaying a patient's heart rhythm. They stood in comfortable silence for a minute. He had been her commanding officer for 6 years. He knew her better than almost anyone. "We tried to tell you the quiet life wouldn't stick, Vance," he said softly. A ghost of a smile touched her lips. It was the first time she had smiled all night. "Thought I'd give it a try," she murmured. The paperwork is worse here. He chuckled, a low, rumbling sound. I have a C-17 flying into the local airbase. It can have you back at Bragg by noon. We have an opening for a senior instructor. Alara finally turned to look at him. She looked around the ER, at the nurses moving with quiet efficiency, at the sleeping patients, at the small, orderly world she had created out of chaos. Here, she wasn't a weapon. She was a healer. Here, she wasn't fighting a war. She was protecting lives. I think I'll stay, she said. For a little while, at least. Someone has to vet the new guy. General Thorne studied her face, then nodded in understanding. All right, Sergeant, you hold the line. But if you ever send up a signal again, try to give us a little more warning. I had to pull a favor with the FAA to get our birds in here without starting a national incident. I'll keep that in mind, sir. He placed a hand on her shoulder for a brief moment, a gesture of profound respect and affection. Take care of yourself. Then, he was gone. Alara Vance stood alone in the quiet hum of the emergency department. She was exhausted. She was emotionally battered, but for the first time since she had taken off her uniform, she felt whole. She was not a hero. She was not a witness. She was a nurse, and she was exactly where she needed to be. The sun rose, flooding the room with the light of a new day, and she got back to work. If you want to see more stories where the underestimated become the unforgettable, make sure you subscribe, because your support is what keeps these narratives alive. And let me know in the comments, have you ever had a moment where you had to reveal a hidden skill to solve a crisis? I'd love to hear your story. Thank you for listening, and be sure to tune in for our next video, which is already on your screen.